Hi guys, so now I'm here at Publix. So here, my daughter. So I'm here at Publix waiting for my turn for my second Moderna vaccine. So when I first got here, I go to the pharmacist, and then actually she is the one who asked me if it's my second vaccine. So I said yes. So I gave her the plastic that they gave me for my first vaccine, which include the card, and then there is a form. So I fill out the form. I will read you all the questions in the form later, and then I just sign, and then I confirm my address, and yeah, so now I need to wait here for my turn. I will get back to you. Done with my shot. So the doctor double checked the form, the questionnaire, and I did a mistake about the because I checked yes on the allergies, which is I did not have after the first vaccine. So she just confirmed that to me, and then yeah, she gave me the shot on my left arm. So yeah, so I need to wait 15 minutes if there is an allergic reaction, and after 15 minutes, so I gotta go. I'm good to go. So yep, I will keep you posted what will happen, and then I will read all the questions on the questionnaire on the form. Okay. Hi guys, so we're already home and I'm done with my second Moderna vaccine. I'll show it to you. So there you go. So I did not feel anything. Like the first time I felt dizzy, and then my arm hurts so bad right away. But right now I don't feel anything. I did not feel dizzy. My arm is not hurt, but the doctor said it will take effect after 24 hours. So let's wait until tomorrow if I will feel something, and then I will let you know. But I'm good, whatever, if I feel dizzy or whatever tomorrow, because I'm off. But I really hope I will not have a fever tomorrow. Okay, so I do have the questionnaire here. So this one, and I will read it to you one by one so you will have an idea what are the questions on the form, because I did a mistake to one of the question on the form. Good thing the doctor double check the form, and then she asked me if I did have an allergic reaction after I took the first vaccine, and I said, oh, no, 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 no. And then she erased it, and then she checked no. Okay, so on this form, pre-vaccination checklist for COVID-19 vaccines. It says here, for vaccine recipients, the following questions will help us determine if there is any reason you should not get the COVID-19 vaccine today. If you answer yes to any question, it does not necessarily mean you should not be vaccinated. It just means additional questions may be asked. If a question is not clear, please ask your healthcare provider to explain it. Sorry. Okay, the first question, are you feeling sick today? Second, have you ever received a dose of COVID-19 vaccine? If yes, which vaccine product did you receive? Pfizer, Moderna, Johnson or Johnson & Johnson, or another product? Third question, have you ever had an allergic reaction to? This would include a severe allergic reaction, for example, anaphylaxis that required treatment with epinephrine or EpiPen, or that caused you to go to the hospital. It would also include an allergic reaction that occurred within 4 hours that caused hives, swelling, or respiratory distress, including wheezing. And then a component of a COVID-19 vaccine, including either of the following: polyethylene glycol or PAG, which is found in some medications such as laxatives and preparations for colonoscopy procedure. And then polysorbate, which is found in some vaccines, film-coated tablets, and intravenous steroids. And then a previous dose of COVID-19 vaccine. And then a vaccine or injectable therapy that contains multiple components, one of which is a COVID-19 vaccine component, but it is not known which component elicited the immediate reaction. So you just only check yes or no or don't know. Okay? Number 4 questions. Have you ever had an allergic reaction to another vaccine other than COVID-19 vaccine or an injectable medications? Then it says here, this would include a severe allergic reaction. Example, anaphylaxis that required treatment with epinephrine or EpiPen or that caused you to go to the hospital. It would also include an allergic reaction that occurred within 4 hours that caused hive swelling or respiratory distress, including wheezing. Then number 5 question, have you ever had a severe allergic reaction, example, anaphylaxis, to something other than a component of COVID-19 vaccine or any vaccine or injectable medication? This would include food, pet, venom, environmental, or oral medication allergies. Then 6, have you received any vaccine in the last 14 days? 7, have you ever had a positive test for COVID-19 or has a doctor ever told you that you had COVID-19? 8, have you received passive antibody therapy, monoclonal antibodies, or convalescent serum as treatment for COVID-19? The 9, do you have a weakened immune system caused by something such as HIV infection or cancer, or do you take immunosuppressive drugs or therapies? 10, do you have a bleeding disorder or are you taking a blood thinner? 11, do you have a history of or a risk factor for a blood clotting disorder? 12, are you pregnant or breastfeeding? 13, do you have dermal fillers? So that is the questions for vaccination checklist for COVID-19 vaccines. And the next form, this is the immunization consent form. Okay, of course, you will write your name, birth date, age, sex, address, city, state, zip code, phone number, Medicare ID, or if you are a Publix associate, you need to write your personal number and then primary care provider name. So you need to write those information. And then next, precautions and contraindications. Please mark yes or no for each question. So first, are you 18 years of age or older? Age restriction may apply to certain states' vaccines. Consult the pharmacist. Number 2, do you have a cold, fever, or acute illness? 3, do you have any allergies to medications, food, or any vaccine? Then you will write on the form what is it, and then you will click. You need to check yes or no. Okay. 4, are you allergic to chicken eggs or egg product? 5, are you allergic to thimerosal, cleaning products, or contact lens solution? 6, have you ever had a serious reaction after receiving a vaccination? 7, have you ever been diagnosed with Guillain-Barré syndrome for meningococcal? I'm sorry for my pronunciation if I mispronounce it, okay? 8, do you have a seizure, brain, or nerve problem? 9, have you had a physical exam with the last year? 10, do you have a weakened immune system because of HIV or AIDS or another disease that affect the immune system? Long-term treatment with drugs such as high-dose steroids or cancer treatment with radiation or drugs? 11, do you live with or expect to have close contact with a person whose immune system is severely compromised and who must be in protective isolation? 12, during the past year, have you received a transfusion of blood or blood products or been given a medicine called immune gamma globulin? 13. For women, are you pregnant? Is there a chance you could become pregnant during the next month? 14. Have you received any vaccination in the past 4 weeks? 15. For intranasal influenza, do you have a long-term health problem such as heart, lung, kidney, liver, or metabolic disease, example, diabetes, neurologic or neuromuscular disease, anemia, or other blood disorder? So if you answered yes to question 2 to 15, you must talk with your pharmacist before being vaccinated. And then you will just sign and then date and I think if it is, because it says here signature of patient or legal guardian and then relation to patient, if patient, and then date. Okay. And then, of course, the lower part is for the pharmacist. Okay, so those are the questions on the form. The first form is free vaccination checklist for COVID-19 vaccines. And then the second form is the immunization consent form. So, if you will do your first vaccine, you will fill out this form. And then on your second vaccine, you still need to fill out this form. And I do have the card. So the first time I got my vaccine, they put a sticker on it with a date for my first dose. And then now they put a sticker again in the card and they write the date of my second dose. So I'm still good. I did not feel anything right now. So I'll keep you posted tomorrow what will happen. I'm pretty sure tomorrow I will feel the pain because my husband he already took his second dose Moderna and he did not feel it after, but the next day that's the time he feel that he is so tired and then his arm is hurt and it's like it's heavy, so something like that. Okay, so see you tomorrow. Hi guys, so today is my second day after I took my second dose vaccine, Moderna vaccine. So I wanted to update you what is the effect of the vaccine on me for my second day. So I do have a terrible migraine. I don't know if this migraine is the effect of the vaccine. I really don't know. I don't have any idea because I I did not hear anything that someone have a migraine after their vaccine. Maybe it's only me. I really don't know. So I do have a terrible migraine. I feel dizzy. I'm tired. I just want to just lay down and sleep. And then my left arm, I feel it's heavy and it hurts so bad. And good thing I don't have fever. So the effect of the second shot is different from others. So don't expect whatever I feel that you will feel it too, because it it is really different. So I heard that others feel like they are throwing up and then they have a fever, but those I did not feel those effect on me, so that's a good thing. Okay, so yeah, so I already mentioned to you what is the process for the second shot Moderna vaccine, what are the forms that you need to fill out, what are the questions on the form, so you will have an idea, and then the effect of the second shot Moderna vaccine on me. And yep, so I hope this video will give you an idea, and good luck to all that planning or already have a schedule for their first or second shot for COVID vaccine, either Pfizer, Moderna, Johnson and Johnson, or other brand of vaccine. And they also told me that after 8 days, once you already complete your second dose of COVID vaccine, you are no longer needed to wear your mask. That's what they said. It's like you are already protected because you completed the second dose of vaccine. But for me, this is only for me. It depends on you. But for me, I told my husband that we still need to wear masks because I am not comfortable. Even I do have a vaccine, I still wanted to, just to make sure. Okay. And also we do have a 4-year-old daughter. Oh, actually 3-year-old daughter. 3 years old daughter, and I don't want her to ask me or Marcus why we are not wearing masks, and then she is wearing her mask. So she will be confused or whatever. So just to be safe, we will still continue wearing masks. So it's up to you. If you wanted to wear mask or you don't want to wear mask, as long you completed your second dose of your vaccine, then go ahead. You have a free will to do whatever you want. Okay, but just take care. Okay, and yeah, good luck to everyone. God bless and be safe. Bye bye.